Thank you very much, Dr. Solomon. The next speaker is Dr. James Hospedales, the Executive Director of the Caribbean Public Health Agency, or CARPHA. Some of you may recognize Dr. Hospedales because he was actually one of our speakers in 2014. And you may recall that he started off by asking who was in the room. He took a quick poll to see if we had enough of the stakeholders around the table. And I think we all got the message loud and clear that health is not just a medical or healthcare practitioner's realm, that we really need to spread out and make sure that we bring in and integrate all the different sectors into health for the country. Dr. Hospedales, last year we had a planner as one of our speakers, and we have tried to make sure when we plan the conference that there is something for everyone and all the sectors can come. So thank you for that when you were here last time. But tonight, Dr. Hospedales is going to talk about writing the next chapter, achieving goals for a healthier Caribbean region. He's a citizen of Trinidad and Tobago, and as I mentioned, the Executive Director of CARPHA since February 2013. From 2006 to 2012, Dr. Hospedales was responsible for the Pan American Health Organization's program for prevention and control of chronic non-communicable diseases. He played a key role in increasing priority and resources for the NCDs, including helping organize the CARICOM and United Nations summits on NCDs. He pioneered the Pan American Forum for Action on NCDs, which brings together governments, civil society, academia, and business. He has also been a champion for civil society involvement in efforts to improve health and helped catalyze the formation of the Healthy Caribbean Coalition. From 1998 to 2006, Dr. Hospedales was director of the Caribbean Epidemiology Center. He was instrumental in developing donor partnerships for HIV and AIDS prevention and a partnership with the Caribbean tourism industry to improve health, safety, and environment conditions. Dr. Hospedales was a member of the Caribbean Commission on Health and Development, which made policy recommendations in 2005 to the heads of government and named chronic diseases as a super priority for the region. As the Executive Director of CARPHA, he is focusing on multi-sector action, aiming to build a partnership with economic sector actors in the region to combat childhood obesity. He is also working to increase investment in public health in the region. Dr. Hospedales' career has included service as an Epidemic Intelligence Service Officer with the U.S. Centers for Disease Control, as an epidemiologist at CARIC, and several years working in public health for the UK National Health Service. Dr. Hospedales graduated with honors in medicine from the University of the West Indies. He has a Master's of Science degree in community medicine from the London School of Hygiene and Tropical Medicine, is a fellow of the UK Faculty of Public Health, and an accredited partnership broker with the Partnering Institute of the United Kingdom. He has published more than 60 papers and reports. Ladies and gentlemen, please join me in welcoming Dr. James Hospedales.
Thank you very much, Madam Chair. Good evening, everyone. Jennifer Ahern, Permanent Secretary, Chief Officer and Permanent Secretary, Dr. Solomon, President of the Medical and Dental Society of the Cayman Islands. Good evening to you all. Thanks for the invitation to speak at this conference. I'm impressed by the growth of the event since I was here 2 years ago. Now, 2 years ago in 2014, when I was here, we were in the grips of the chikungunya epidemic. And now I'm back in 2016, and we're in the grips of the Zika epidemic. I hope there's no connection. If you invite me back in 2018, I don't know, we're actually predicting a dengue type 3 epidemic in 2018. And since my colleague started off with a comment about the Sphinx, it reminded me of a joke. Now, this is an adult joke. Is there anybody here under 18? Yes? Then you probably need to leave the room. Or maybe I shouldn't tell the joke. Wait for the cocktails. But it goes that the camel, the ship of the desert, is not as wise as everyone thinks. Because when the sex urge is upon him, he jumps on the back of the Sphinx. But the Sphinx's posterior passage are blocked by the sands of the Nile, which accounts for the hump on the camel and the Sphinx's inscrutable smile. So somebody can explain that to the under 18-year-olds who are here. Joking aside, it gives me great pleasure to address you at the opening of this conference, which embodies the commitment of this country to health and wellness of its population. I was quite impressed last time, too. I remember you had a new Mental Health Act, and that seemed very modern, and much of the rest of the Caribbean could learn from it. Health and wellness are essential factors to the Caribbean region's development, and although we have made tremendous strides in the past few decades, we cannot neglect the efforts that must continue to maintain these gains and progress in the future. As Jennifer was reciting all the things that I've done, I think probably my stint as the executive director of CARFA will be the last chapter of my public sector life. And I don't know what I'll do after, we'll see. You know, there's a big election brewing up north of us. I won't make any comment on this year's campaign. But a few years ago, there was an election campaign that had a famous line in it. It's the economy, stupid. How many people remember that? It's the economy, stupid. If you Google that, you'll figure out which presidential candidate was famous for that. And when I consider our region and the large negative economic impact of preventable health issues, when I see as a region we barely achieved 1% growth last year, as a whole region. Cayman have done better, but the whole region is 1%. And this year we will be stagnant or the economies will contract. I say it's preventable health issues, stupid, that are keeping us back. And in this talk, I'm going to talk a bit about why I believe that and present some evidence about that and why the addressing preventable health issues is going to be very important for economic development of our region as a whole. At the center of health and sustainable development in the Caribbean is the Caribbean Corporation in Health. And the Caribbean Corporation in Health looks at health and wellness, increased economic productivity, national development goals, regional development goals, and those are connected to something that binds the whole world together now, the Sustainable Development Goals, or the SDGs. They were approved by all the governments of the world last year, and there's a big health one in there, SDG number 3. There's a number of others that relate to health, including ending hunger and poverty, water and sanitation, climate change, safety and security, a number of others that relate to that. The Caribbean Corporation in Health Initiative, I'm trying to advance my slides, there you go. Where have we come from in thinking about writing the next chapter is I want to look at the framework that has been used since the mid-1980s with the purpose of focusing on priority health issues, securing funding for the implementation of projects, and promoting cooperation between countries. It's now we're just entering the 4th iteration, CCH4. And I believe it has to be the engine, as I say, or an engine of economic growth, and has to help position the Caribbean region to meet the United Nations Sustainable Development Goals, taking into account the peculiarities and the vulnerabilities of our small island developing states, or SIDS, as this part of the world is called. I really believe health can contribute a lot. Now, if you look back, as we think of the next chapter, if we look back at the chapters that have gone before, from the mid-1980s to the mid-1990s, we saw the elimination of measles in our region. This was the first region of the world to do that. We might be small, but we could do big things. In 1992 and 1993, I was an epidemiologist at CAREC at the time. How many people born since 1991 in this room? A few. I see Annie Banks over there sticking up her hand. But if you've been born since 1991, you would never have seen a case of measles. If you're a doctor that qualified since then, you would never have seen one. And it was because of the success of this in eliminating measles, the first in the world to do so. In CCH2, which ran from about the mid-90s to 2005, we saw a massive scaling up in the response to HIV and AIDS. over 1.2 billion external dollars mobilized. Today, many of our countries in the Caribbean are in the process of certifying elimination of mother-to-child transmission. We're seeing that we can end all transmission in the next 10 years. Who could have dreamed that at the start of the fight in the late 1980s? I was the director of the Caribbean Epidemiology Center at the time, so that was my chapter at that point. And in CCH3, we took the problem of non-communicable diseases to the level of global attention, beginning with the Port of Spain Summit of CARICOM heads on NCDs, September the 15th, 2007, through the Summit of the Americas and the Commonwealth Heads of Government meeting in 2009, to the UN General Assembly in 2011. I was the head of NCDs in PAHO in Washington at the time. And now the NCDs are firmly embedded in the Sustainable Development Goals of the world, with a 25 by 2025 or 30% reduction by 2030 in preventable mortality as a clear target. So that's a wee bit of where we've come from as a region, which is good to reflect upon as we consider writing the next chapter in Caribbean health. And as we consider that, a pertinent question is, well, where are we now? Where we are now is, as a region, we are some 17 million people in 20 countries of CARICOM, 40 million in the wider region. We're tremendously diverse in size and GDP per capita. Cayman, 60,000 people. Trinidad, 1.2 million. But Trinidad and Cayman are small in global terms. But again, as I say, it doesn't mean that we're small. We can't do big things. And we may have Cayman on the one hand, Trinidad on the other, Barbados, Belize, but we all dance the same way. I was watching that the other night at a regional meeting, and people have different accents, but they all move the same way. So music is something that binds us. A small island and low-lying development states, we are particularly vulnerable to natural and man-made shocks. We're highly dependent on trade and imported food, which is part of our problem with our obesity epidemic and NCD epidemic. And we have several preventable health and environmental challenges that represent significant threats to health and economic security. The mosquito-borne viral diseases such as chikungunya and Zika have revealed gaps in regional health security, which has direct effects on economic sectors such as the tourism industry. In fact, the Aedes aegypti mosquito, a domesticated mosquito in the houses of most people in the tropical world, is a gap in global health security. The ease with which it can spread a number of viruses is a bit scary if you've been in public health for some time. The population of our region is undergoing a rapid demographic shift, with people over 60 years of age being the most rapidly expanding part of the population. That demographic shift is further complicated by the high preventable chronic disease burden in the working age population. That situation is actually threatening the very sustainability of social security institutions in the Caribbean, as recently pointed out in an article by the International Monetary Fund. And in that instance, programs of healthy aging actually become an economic imperative, not just a good thing to do, to reduce the cost burden related to chronic diseases and their complications. The Economic Commission for Latin America and the Caribbean has realized this, and last year we sat with them to launch a program of healthy aging for the region. I'll talk more about this tomorrow in the panel on aging. With increasing population and development, our countries have also become more vulnerable to environmental degradation, coupled with overarching issues of climate change and global warming. If you witnessed the devastation that was wrought by Tropical Storm Erica last year, I had never seen anything like that. I was on the Caribbean Disaster Response Team for 10 years. I was mobilized 8 or 9 times, and I had never seen the mauling that Erica wrought on Dominica last year. Everybody's familiar with Matthew, which passed by recently and for a while was threatening the Cayman very directly. But how many people realize that Matthew was the longest ever surviving Category 4-5 hurricane? No Category 4 or 5 hurricane has ever stayed at Category 4 or 5 for so long, which is a symptom of the climate change and the global warming, so that the warm sea was able to keep powering that hurricane for so long. It was an amazing storm. We were tracking it since, I think, the 26th or the 27th of September, every day on the video conferences. And it passed through the Eastern Caribbean. It gave a brush to the ABC Islands, Aruba, Bonaire, Curaçao, and then it turned north and came up this way, passing between Jamaica and Haiti, and devastated a large part of Haiti. Then over the Turks and Caicos and the Bahamas. We haven't been hearing about it, but the Bahamas took a good hit in Grand Bahama, New Providence, and Andros. We've had teams there for the last couple of weeks from CARFA, and they've been bringing us back a lot of information. So climate change and the attendant risks that we face in the region are important. It's partly why our conference next year, we have an annual conference. The theme is going to be climate change, the environment, and human health. In food production and in water and sanitation, we've made a lot of strides, but the developing agricultural, industrial, and tourism sectors have put a lot of stress on our environment, increased pollutants to waterways and oceans, and we have a threat to food security and the sources of potable water for our populations. Some of our countries experience much longer periods of drought now, and then you switch around and you have an immense amount of rainfall dumped in a very short time. With the infectious diseases, we've made a lot of gains, and I alluded to some of them earlier. Vaccine-preventable diseases such as polio, measles, and rubella have been eliminated from the region. That's just remarkable. HIV is no longer one of the top causes of death, and as I said, vertical transmission has nearly been eliminated. Despite these, we still lag as a region behind. We lag behind in our targets for tuberculosis. Emerging and re-emerging infections continue to threaten our health security, with over 50 million visitors to the region now every year. The problem can come from one part of the globe to here overnight. Foodborne outbreaks pose a risk still for the region. Things like norovirus and the ever-growing size of cruise ships poses a challenge in that regard. And the silent epidemic of antimicrobial resistance, which can generate insurmountable health costs, is what the WHO Director General calls a disaster in slow motion. I confess about 8 or 9 years ago, I thought, what's all the fuss about antimicrobial resistance? But more recently, I've realized this is indeed a serious challenge. We've only been on this planet for a very small time compared to the 3 or so billion years that bacteria have been on the planet. Anybody know how many cells there are in your body? About 10 to the 14. You know how many of those are bacteria? About 90%. So we're mostly bugs. Isn't that a funny thought? But that's to put us a little bit in our place. We've only been here a short time compared to bacteria, and most of the cells in our bodies are bacteria. But that's one of the, Bible says pride cometh before a fall. And collectively as humans, we're so proud, we think, we've conquered these germs. But we've just begun with them. They've been here a lot longer. So that's a really big challenge. In health terms, however, in terms of preventable loss of life, preventable suffering, and in dollars, the biggest challenge is the NCD epidemic, which accounts for 8 of 10 deaths and the ever-increasing preventable healthcare costs. Diabetes, hypertension, ischemic heart disease, strokes, and cancers are the top causes of deaths in our region. Studies in several of our countries in the Caribbean, from Jamaica, Bahamas, Trinidad, Barbados, shows that between 3 to 8% of the gross domestic product is negatively impacted. In a new study in Trinidad and Tobago this year, the economic impact of diabetes, hypertension, and cancer were found to be US dollars 1.2 billion annually, or 4.3% of the gross domestic product. 40% in direct healthcare costs and 60% in indirect costs to the economy. In most of our countries, 40% of the adult population have 3 or more risk factors for non-communicable diseases, with persons 45 to 64, which is your peak working age population, and women being at greater risk. Obesity has reached epidemic proportions in adults, particularly in women, driving increased rates of diabetes, of cancer, of cardiovascular disease, mental health problems like depression and anxiety, and driving some employment-related problems. More alarmingly, obesity is emerging in children and adolescents. 1 in 3 to 1 in 5 of the region's children are now overweight or obese. As CARFA, we have prepared a regional plan to promote healthy weight and prevent childhood obesity with a 6-point policy package to reduce obesogenic food environments being put before the CARICOM Council of Trade and Economic Development. That's why in PS's introduction, she said I was focusing on building partnership with the economic sector. Most of what's driving the obesogenic environment is not the health sector. It's trade, it's agriculture, it's economic sector actors. And I've been reaching out to them to say, hey, your policies are causing us grief. We need to work together. We need to look at options that can address this. So that's a big problem. It's a bigger problem if you're in public health as well, or in any kind of endeavor, when you consider that no country in the world has turned around an obesity epidemic at national level. Let me say that again. No country in the world has turned around an obesity epidemic at national level. But I like challenges like that. You can find countries that improve hypertension treatment, improve cancer management, countries that have done something about dental caries, you name it, people have usually found a way to deal with it. But no country has turned around an obesity epidemic at national level, which tells you a couple of things. It tells you this is a really difficult challenge if nobody succeeded. And it tells you that it's not easy to fix. It's complicated. There's no silver bullet. There are a lot of contributory causes. So policies for the promotion of healthy food environments, which I hear from your lineup, Fitzroy Henry is going to be talking about, require a multi-sectoral approach, have now come to the attention of our heads of government. In July, at the heads of government meeting of CARICOM, there was a clear understanding of this, and that the health and economic sectors need to work together. Eventually, you need behavior change at the individual level, but that has to be buttressed by a supportive environment. It has to be buttressed by public education. 3 weeks ago in Washington, at the meeting of the Council of Human and Social Development of CARICOM, the ministers agreed to a region-wide, sustained, evidence-informed communication and education campaign on NCDs and wellness using traditional and new media. So that's quite a strong charge to us in public health at the regional level. Increasing sedentary lifestyles are also because of the built environment that we live in and the way we design roads, the way we design communities, and the lack of recreational spaces. New housing development, when the British were the colonial masters, they were a little smarter. You'd see developments with a little park, recreational spaces. Often now, developers in the Caribbean just fill every square meter with housing and roads, and there's little or no place for recreation. So the built environment has to be tackled, putting in bike lanes, putting in walking paths, promoting the use of alternative transportation like biking and walking. That's good for the planet, it's good for human health, and it's good for energy security. Among the other challenges we face are alcohol and depression, two of the major mental health issues in our region, with comorbidities, but also co-benefits from action if we tackle them. Analysis of social determinants shows more and more increasing concentration of tobacco use and obesity with low SES groups in our countries. And so tackling those problems can also help to reduce inequity in our countries. After this one, I'll be running through some slides that have quite a bit of data on them. These are some of the achievements of the region that I've touched on earlier, the Port of Spain Declaration on NCDs, the formation of this Healthy Caribbean Coalition, which is a 60-member NGO alliance for combating NCDs, and a number of other gains that we've made as we look back. Travel and tourism, I touched on. We're the most tourism-dependent region in the world. Majority of hard currency earnings, but we're vulnerable to health and environmental threats. And so we have a context for action that I've also been talking about with the environment, with aging, child obesity, injuries and violence. I want to speak a little bit more about. The trends for injuries and violence in our region are also cause for concern. It's linked to harmful use of alcohol, but that's not the only cause. Vehicular accidents, homicides, suicides are on the increase in many of our countries. These impact not only the families and the individuals involved, but are also spawning an epidemic of fear and stress. People put up burglar bars and hire private security forces instead of investing in health and education. Several countries in the Caribbean are having what can only be called epidemics of homicide. The Caribbean rate of homicide overall of 30 per 100,000 is nothing to be proud of. And if you're not familiar with that, well, the United States has a rate of 5 per 100,000. Canada is about 1.5 per 100,000. And the United Kingdom is less than 1 per 100,000 population dying from homicide per year. And we're 30 per 100,000. That's nothing to be proud about. There are many complex causes of this, including harmful use of alcohol, including inequity in some of our countries, including, this is my belief to some extent, men falling behind in the education sector. More and more in the universities in the Caribbean, you're seeing a high proportion of admissions being girls. That has to be troubling for people, a thoughtful citizen. So reflecting a bit on that, the way ahead, the next chapter is a challenging and complex one. A lot of challenges that are blocking sustainable development, and it underscores the need for multi-sectoral action. We have social determinants I've just been talking about, poverty, education, trade, we import nearly all of our food, the business forces that we deal with, the bombardment of advertising, targeting especially young children for the built environment. Our health systems also we have work to do in strengthening our health systems, to have health security, the kind of policy, the information systems that we need, regulatory policies that are needed. So what's the next chapter going to look like? I think there's some data slides here that I wanted to show. I talked about the demographic shift of the world. So if you look back 2 generations, the world this is the global situation of a pyramid, a population pyramid. And if you come to the present, it's looking like that. And some years from now, it just looks like a skyscraper. And in some of our countries, it's actually shrunk at the base. So the base is smaller than the middle of the pyramid. And that means many things. Among the things it means is that there are fewer people paying contributions in Social Security. It means that if you have a sickly middle-aged population, you have a lot of paying out of benefits, mostly due to preventable health problems. And if you're not getting returns on capital, you have a real problem with the sustainability of Social Security, which is the point I've been trying to make for the last couple of years to the directors of Social Security of the Caribbean. And they're listening. They're scared. They have no mandate for prevention of these problems. But by partnering, we have mandate for prevention. We just don't have the money. We need the investment to be able to tackle some of the challenges we face. Go back. Yeah. So the demographic transition advancing in most of the countries of the Caribbean and Central America. I'm not sure in Cayman. We have the figure there, but I can't quite read the percentage that's over 60. It looks like 15%. And this is the study from Trinidad and Tobago to which I referred, the cost of cancer, hypertension, and diabetes. Cancer, hypertension, and diabetes. The pale part is the direct medical care costs, and the purple is the indirect cost. So indirect is like you're out of the workforce, so you're no longer earning income. Some family relative has to stay home to look after you. That's indirect cost. Direct cost is the direct medical care costs. This shows the broad causes of death in the region, and the red across the middle is the non-communicable diseases. When you look at the regional deaths, by age group, then you see a very interesting thing. And this is proportional mortality. And you see that the green is all the NCDs, particularly in the Middle Ages and onward. But the lilac is violence and injuries. This is an amazing graph, an amazing chart. The amount of problem we have with injuries in the Caribbean, especially in your younger age groups, especially among your young men. This is a more technical graph of potential years of life lost by age group for different age groups. It really shows the dominance of the non-communicable diseases, and NCDs are our number one killer. About 40% of Caribbean people are living with hypertension or diabetes or high cholesterol. Prevalence of overweight and obesity, with Aruba in this set of data over on the left there, and the slimmer countries are like Dominica, where they still grow a lot of their own food and walk a lot more. But even there, obesity among women is 30%. Where's Cayman on this chart? There we go, there's Cayman. So you're among the leaders in this statistic anyway. Harmful use of alcohol. The folks from St. Lucia and Aruba didn't like me showing this chart. These data all come from the standardized stepwise surveys for risk factors for NCDs. And this is the Caribbean scorecard for NCDs, which is every year we monitor how we're doing, 20 countries, 26 indicators. It's going to be hard for those at the back to see this. But if you look across this middle bit, you see all that red? All that red relates to the diet and nutrition environment. We have not been able to get trade policy to include consideration of nutrition. We've not been able to get mandatory nutritional labeling of food, processed food in the Caribbean. If we're going to export it, we label it. But if it's for our own people's consumption, we don't have mandatory labeling requirements, and so on. So this is an area that I've put some of my personal attention in to focus on. When it comes to healthcare, we're doing a bit better, although there's still a long way to go. In Trinidad or in Jamaica, Barbados, there's policies for free medications for hypertension, diabetes, and cholesterol. But people actually only take their medicines about 45% of the time, which is interesting. The government's seen the light, made the policy, free medicine, but people only take it less than half the time. And why is that? And to what extent can we address that? Among the reasons that this is anecdotal, we've got is among men. People think, well, I've got to drink this weekend, and the weekend starts on Thursday, Friday, Saturday, Sunday. And everybody knows that if you're drinking, you don't take medicine. But that's not true. We should be saying, it doesn't matter if you're drinking, you need to take your high blood pressure pills and take your diabetes medicine. This is the international health regulations and how good we're doing or not doing in respect of these commitments that our governments have made. And this is not changing as easily as I thought it would. Regulatory capacity, we lag behind Central and South America and North America in regulatory capacity for things like pharmaceuticals. Right, so what does the next chapter look like? The next chapter, the CCH4 vision is that Caribbean people will be happier and healthier and more productive, each respected for his or her individuality and creativity and living within cleaner and greener environments. So that's a sort of aspirational vision. Happier, healthier, more productive, respected for individuality, living more harmoniously, killing each other a little less within cleaner and greener environments. And that vision is going to be realized through a couple of goals that have been set: increasing life expectancy for the total population by 3 years. But if you're in this business, it's not only life expectancy, it's the quality of that life, and reducing disability-adjusted life years for all ages, all causes, and both sexes by 10% in 10 years That's the time span of the CCA, the goals for the Caribbean. Tall order, but not unachievable, based on our track record and the progress of the last years in facing big challenges. But if, and only if, we invest in public health programs and population health, educate our people and children, and increase access to preventive health services. That's not access to heart transplants or access to high-tech surgery. It's preventive health services, screening, education. That's where the biggest return on investment is. And I can't stress that enough. That's in my last chapter of my public life. That's what I'm going to be focused on, improving the investment in the most cost-effective public health programs. And often that's not just the health sector. It's trade, it's education, it's agriculture. It's the business sector that need to be worked on if we're going to tackle this. How to achieve this? The overall strategic approach is based on regional cooperation. It's based on collaboration and collective action to produce what are called regional public goods. There are certain principles of equity working towards reducing disparities in health status, access to health and social services. Solidarity, a whole of society approach. Health sector can't do it alone. Country-driven needs. Although we're a lot of small countries, we have to pay attention to what's the situation in individual countries. And leadership in the non-health sectors being absolutely necessary to achieve those goals. There are 5 major strategic priorities for CCH4. These are the guiding principles, including the last one of good governance. And there are a number of priorities. Health systems for universal health coverage. Investing in national health systems to address current weaknesses is an imperative to improve universal health coverage. Health and well-being of Caribbean people throughout the life course to change the current paradigms and implement programs that take a life course approach to health and healthy aging. And that's got to address the preventable costs associated with the NCD epidemic. Safe, resilient, and healthy environments, optimizing country capacity to respond to threats and do so in a timely manner. Partnership and resource mobilization, ensuring that the regional health agenda is supported by traditional and non-traditional partners. And data and evidence for decision-making and accountability, building that regional capacity to generate and use data for planning and programming. This includes research, and I was pleased this morning to visit the Mosquito Research and Control Unit of Cayman Islands, and I definitely got the idea we should be partnering between the Caribbean Public Health Agency and this capacity here in the Cayman Islands. It should be a regional, be serving the region. You have a really excellent capacity here in the region. And the possibility that has been started with Oxitec needs to be very carefully studied and documented whether or not this is a viable option for eliminating the Aedes aegypti mosquito that's plaguing the whole Caribbean and indeed the whole of the tropical world. I have an advertisement to make. The CARFA Annual Scientific Health Research Conference is one of the platforms for sharing evidence, and that's in Guyana, April 27 to 29. The theme is climate change, the environment and human health. The deadline for receipt of papers is December the 1st. So you go on our website, CARFA.org. We would like a good number of papers from Cayman Islands this year. In the context of the Caribbean region, the whole idea of regional public goods is an important one. CARFA itself is a regional public good. We're working on a Caribbean regulatory system for pharmaceuticals, which will see one-stop shop for registration, especially beginning with generics, that will improve access to medicines, decrease costs to government, and make it easier for manufacturers. Quite a lot of work is going on a sub-regional health financing scheme. The Eastern Caribbean is perhaps the most advanced in that. We have to look at models that address the peculiarities of our region and how to integrate things like the NCD agenda into the health and family life education curricula of the region, into the CXC, the Caribbean Examinations Council system. There is no text, there's no systematic study of health in the CXC. And part of the all-of-society approach has to move us towards that. We want to work towards a smoke-free Caribbean by 2020. We, CARFA, are working to sign an agreement with the Caribbean Court of Justice so that smoke-free Caribbean means legislation in all countries banning smoking in public places. It's a human rights issue. That'll be a regional public good that'll be good for us and good for all the visitors that come here. Standards and guidelines which our countries can use in common, such as standards for nutritional content and labeling, and implementing them with simple front-of-pack labeling, color coding. Ecuador has it, Chile has it, and there's a lot of places to learn from with how those things can be done. Common training programs or quality assurance approaches, such as the Caribbean Field Epidemiology and Laboratory Training Program. At CARFA itself, we serve the region, so that's an upgrading of our reference laboratory to continue support for all the different countries. The coordination of the next chapter, the coordination of the next chapter is summarized on this slide. The prime ministers of the Caribbean are organized into a quasi-cabinet. So there's a lead prime minister for health, one for environment, one for economy, and so on. Currently, Dr. Timothy Harris of St. Kitts and Nevis is the lead PM for health through the Council of Human and Social Development. There's a steering committee that includes countries, civil society, a secretariat, and then implementing agencies. The chief medical officers in this model play a lead role in the steering committee and as focal points at country level. And the Pan American Health Organization, CARFA, and CARICOM Secretariat are the core partners in the coordination mechanism. Our agency is strategically positioned to help drive the region to achieve the goals in the next chapter. And as I said, it actually is an expression of CCH. Though the current goals are far-reaching, by working together, CARICOM, PAHO, and CARFA, and with a whole host of partners, some of which are shown here, I believe it's possible to achieve some of the ambitious goals that we have been set. Working together with member states, with partners, with the help of God, we can do it. I thank you for your attention, and I hope that we will be having a very productive conference. If this is where we are and we're climbing up, that we believe we can get there for CCH4. Thank you very much.